My name is Christy Matheson and I'll be your moderator for today's press briefing. Before we begin, I'd like to introduce the Premier of Nova Scotia, the Honourable Iain Rankin, and Nova Scotia's Chief Medical Officer of Health, Dr. Robert Strang. Go ahead, Premier.
Thank you, Christy. Good afternoon, everyone. Before I get into today's update, I want to acknowledge that yesterday my government tabled its first budget. The past year has been a difficult one for many, both personally and professionally. The impact on our people, businesses, and economy has been significant. But given our collective efforts to respond to COVID-19, Nova Scotia is rebounding faster than most. Budget 21-22 will help with these efforts. We are investing millions in specific COVID-19 related initiatives, including the vaccine rollout, personal protective equipment, and helping our nurses. As we focus on recovering from COVID-19, we have an opportunity to learn from the past year and work towards creating a fair and prosperous future for Nova Scotia. Budget 21-22 is government's first step in this new direction. I also want to mention a notable federal investment announced yesterday. The federal government has provided considerable support over the last year to help Nova Scotia with COVID-19. And yesterday, Minister Freeland announced $5 billion of additional funding to support the vaccine rollout and to address immediate healthcare priorities and concerns, including surgical backlogs. This is welcome news as we ramp up vaccine rollout and address other important health initiatives. It amounts to about $130 million for Nova Scotia. For today's update, we have 5 new cases, all in Central Zone, and 2 are under investigation. The other 3 are close contacts of previously reported cases. There have been cases associated with schools, and Dr. Strang will speak to that in just a moment. As of today, we have 27 active cases and no one in hospital. As you know, yesterday, New Brunswick placed the Edmundston area back to the red alert as they are experiencing an outbreak of COVID-19. As a result, yesterday we advised Nova Scotians to avoid travel to the city of Edmundston and the surrounding communities. Dr. Strang and I are watching the situation very closely, and if we need to close our border to New Brunswick again, we will. Now I'd like to give you an update on our vaccine rollout. So far this week, over 20,000 Nova Scotians have received vaccine, and every day we're vaccinating more people than we were the day before. We told you Tuesday we would start moving up through the age groups. So I'm pleased to say that we're ready to start opening up for those over the age of 75. And if you're still over the age of 80, of course, you can continue to book your appointment. The first mobile clinic and first shelter clinic will be up and running on April 1st. A couple of weeks ago, I mentioned the transportation option for Nova Scotians who need assistance getting to their appointment. The organization is called Rural Transportation Association, and they will provide an accessible door-to-door ride service that is available to all Nova Scotians. I'm very pleased to tell you that the Departments of Health and Wellness and Community Cultures and Heritage will provide $200,000 to help subsidize this service. The funding will help community transportation providers offer the service at a reduced cost to citizens who need help getting to their appointments. You can find more information about that at our coronavirus website, and you can book your appointment for transportation at 1902-896-7433. Thanks, and I'll now turn it over to Dr. Strang.
Thank you, Premier. Good afternoon, everybody. So more than 20,000 doses of vaccine in arms in the last 4 days. That's really great news, and I want to provide a big thank you to everyone who's involved in the planning and implementing our vaccine program. By mid-May, we will be able to deliver up to 86,000 doses of vaccine per week. Behind me, you'll see a graph that was used on Tuesday, and it depicts the amount of vaccine we expect to deliver from now to the end of June. The yellow line shows a steep climb in doses in arms. It also shows when we will be vaccinating each age group. Of course, we have to remind everybody that this graph and the progress on it is dependent on receiving the expected amounts from the federal government. But what you will see is that every week we expect to move to a new age group, a 5-year age cohort, from now until mid-June, when those 16 to 19 become eligible to get the vaccine. We've built a good vaccine program, and now we're getting fast. With pharmacy, primary care, and community clinics now offering vaccine across the province, Nova Scotians are starting to have more options closer to home. These options will continue to grow over the coming weeks. Starting today, Nova Scotians age 75 and over can book an appointment to get a vaccine. So we're adding the 75 to 79-year-olds, and anyone who's 80 and over and has not already booked an appointment can still do so for their 2 doses of COVID vaccine. There are appointments across the province in most communities and pharmacy clinics. Some of the locations are fully booked, but we will be adding many more appointments to those, as well as adding additional locations when we receive our next shipment of vaccine. We did receive word last night that a shipment of Moderna expected next week will be delayed by a week or so. And this highlights the importance of only opening appointments when our supply is confirmed. We don't want to have people book appointments and then have to cancel those appointments because we didn't have certainty of supply at the time of booking. Yesterday, the federal government confirmed it expects to receive an additional 1.5 million doses of AstraZeneca vaccine next week. We expect Nova Scotia will get approximately 38,000 doses, and we're working with our partners now on delivery options, and we don't yet have confirmation of the exact time of the receipt of that vaccine either. Our plan is to first offer this additional AstraZeneca vaccine to those in the age 60 to 64 that we're currently offering it to, so because many of them in that age group have not had an opportunity with our first shipment. And we'll expand from there depending on the uptake in that 60 to 64-year-old age group. Now I'd like to speak about our cases. Yesterday, we identified a case connected to Millwood High School in Middle Sackville. And today, the lab identified a probable case connected to Sackville Heights Junior High School in Lower Sackville. This case is a close contact of the reported case at Millwood High School. And it's still a probable case, but out of abundance of caution, we are treating this as if it is a confirmed case to ensure that all the necessary precautions are taken. And this weekend, the Public Health Mobile Unit will be at the Sackville Legion conducting community-based testing between 9:30 and 5:30. And anyone can drop in or book an appointment online. And we're also working with both the affected schools to arrange testing for all the students and staff in those schools. So while our overall case numbers have increased slightly, I'm not seeing anything yet that is overly concerning. This is the pattern. We're still in the pandemic. We are going to see sporadic cases, and we have appropriate and timely public health follow-up. But what does concern me is the news I'm hearing about variant strains, especially the B.1.1.7 across the country. Many provinces are battling the variants, and they're seeing increased case numbers and a corresponding tightening of restrictions. And I'm watching most closely what is happening in New Brunswick. So while our border remains open to people coming from New Brunswick, we have asked Nova Scotians to avoid non-essential travel to Edmundston and surrounding communities where there is a variant, an outbreak of the B.1.1.7 variant. But there is no reason to close the border at this time. The cases are isolated to that particular area in northern New Brunswick, and travel in and out of that area is restricted. However, if the outbreak starts to move into other parts of New Brunswick, or I feel the situation is getting worse and Nova Scotians are at increased risk, I will not hesitate to make a recommendation to the Premier to reinstate the 14-day quarantine for people coming from New Brunswick. Nova Scotia remains in a very safe but privileged position. We cannot forget what is happening around us and how quickly our situation could change if we become complacent. We do need to keep following all the public health protocols that have protected us from COVID-19 for the past year. Washing our hands, wearing a mask, wearing it properly, and staying 6 feet apart. Border measures and 14-day quarantine continue to be very important and have been critical in keeping our case numbers low. Testing, whether you have several symptoms, one mild symptom, or no symptoms at all, continues to be an important defense against this virus over the coming months. So making testing part of your regular routine it remains important, and I encourage people to do that. It is quick, it's free, and there are locations across the province. And most importantly, please do not go out if you are feeling unwell. Don't go to work, go for groceries or other shopping, go to the gym, don't go out with people for dinner. If you're feeling unwell, go home or stay home and go online and book a test. I want to talk a little bit about long-term care around visitation. Indoor visits to long-term care homes have resumed, but it's very important that if people are feeling unwell in any way that they not visit. Even if you have a scheduled visit, if you're feeling unwell, you should not visit. And even if you're healthy, people still need to follow all the safety measures in place at these facilities. They're there for a reason, to keep our most vulnerable protected. So things like visitor screening, wearing masks, keeping distance, and other directions, infection control directions from facilities are important that people continue to follow those. Only designated caregivers can come and go without appointments. Other family members and friends, you still need to make appointments with the long-term care facility, and you can do that with each facility and understand their specific protocols. I want to close by acknowledging I do know that people are tired of restrictions and people are anxious to have life return to normal. But the way we get there is to continue working together to keep our case numbers low while we are rolling out the vaccine. It's in our hands. We have to continue for the next few months caring for one another and for our communities. Back to you, Premier.
Thank you, Dr. Strang, and thank you, Nova Scotians, for your continued efforts in fighting COVID-19. Due to your efforts, we are in a safe place to roll out vaccine as we get closer to population immunity. Dr. Strang and I talk a lot about the way forward, living with COVID-19 and the protection offered by vaccines. As we near the end of another successful week of vaccinating Nova Scotians, I want to take a moment to thank everyone who is stepping up to be part of our way forward, from the immunizers to people helping those book their appointments to those who came out to get their vaccine. Behind me are just a few photos of the thousands and thousands of people who have come out to get their vaccine. And there are some amazing stories to go along with these photos. At a Halifax clinic, an 87-year-old woman celebrated her birthday while getting her first dose of COVID-19. Her daughter said that the vaccine was the best gift she could get. A daughter in Yarmouth took both of her parents for their vaccines. She followed up with staff to thank them for their care, patience, and compassion shown to her mother, who was very anxious. She also noted that the clinic ran like a well-oiled machine, from registration to recovery. In New Minas, someone gave up a vaccine appointment to help his son and his parents. The son had driven from Digby to take his parents to their appointments. Unfortunately, his mom had mistakenly booked her appointment a few days after his dad, and when a kind woman overheard this, she gave up her own appointment to his wife and booked another one for herself. It doesn't get any more Nova Scotian than that. An immunizer working in the Truro and Amherst vaccine clinics talked about how excited people are to get their vaccines. She said the joy on people's faces as they come in to get their vaccine is her reward. A staff member at the pharmacy prototype clinic in Spryfield said she witnessed a huge sense of relief and gratitude from the patients and their loved ones. Hearing these stories fills me with hope. Hope that with the vaccines, we will soon have another layer of protection from COVID-19. Hope that our businesses and tourism sector will rebound stronger than ever. Thank you, and we'll now take your questions.
Thank you, Premier. We'll do one question and one follow-up in the amount of time that we have for today, starting with All Nova Scotia's Lindsay Armstrong.
Thank you. Hi, Premier. I understand when you altered border restrictions with New Brunswick, you asked them if they were up to doing the same thing and they declined. I'm wondering what reason they gave at the time for why they wouldn't open up to Nova Scotians without quarantine.
Yeah, we all follow advice from our own public health teams, and they're in constant contact. And my understanding was the Premier of the province of New Brunswick did not have comfort from his team at that time. I reached out once I had the advice, and we all make our separate decisions. But at the time, we looked at our epidemiology, which is similar, and we had that comfort here.
Go ahead with your follow-up, Lindsay.
Right, and I recognize that it is up to each province to make these decisions. I'm just hoping to help clarify for those who are a bit confused about why the borders aren't open on both sides. Could you help us understand what the benefit is in opening up to New Brunswick when they cannot open to us, given that at this stage we do have fewer cases?
Yeah, the benefit is when people come here, they don't have to self-isolate. So same with if our Nova Scotians are going to New Brunswick after they do their self-isolation there and they return home, they won't have to self-isolate. So we're getting positive feedback from those people. Ideally, you wouldn't have it on both ends, but similarly to PEI, which hasn't had isolation at all since the last bubble, there's benefits on that as well.
Next question will go to CBC, Jean Laroche.
Dr. Strang, you said that there was a Moderna shipment that's going to be a week later. Can you give us a more detail on that? How many doses are we talking about, and is it likely to take you off your trajectory in terms of who gets vaccinated and when?
I don't have the numbers of the exact amount. We were just notified of this late last night, and it's about a week delay. We're fortunate that we're able to adjust within our existing supply of Moderna, so it should not take us off target as long as as it's only a week delay. So we're adjusting right now. We're gonna have to. We're not opening up any more clinics or the use of Moderna beyond what we currently have scheduled until we get assurance of this next supply.
You can get that number from your office?
Yeah, we'll be able to get that, yeah.
And in terms of, as you know, people who are immunocompromised can get the vaccine, but it likely won't have the same effect or same protection as if the person is healthy. What thought has been given to allowing those people access to more than one vaccine when that becomes available? In other words, I'm not asking you if I get one shot, I need the second dose, but if somebody wants the AstraZeneca sooner, but then wants the Pfizer later to try and up their immune system, is that possible? What kind of discussions have you had about that?
So there's nothing that, people, all of the vaccines other than Johnson & Johnson are having our 2-dose schedule. And we're now following them. They're 4 months apart. There's studies underway, but we don't have appropriate approvals because there's not the clinical trials yet to say if you get one vaccine for your first dose, you can get a different type of vaccine for your second dose. And there's nothing at all out there that's saying you could get a third dose of a different vaccine that would give you somewhat of somehow boost your immunity. So nobody is looking at that. It's really a 2-dose schedule, and right now the 2 doses have to be the same vaccine.
Next question will go to Halifax Examiner's Tim Biscay.
Dr. Strang, there's the EU has legislation before it talking about a 6-week ban on exports. Canada gets most, if not all, of its vaccine from the EU. Have you been in discussions about what the status is of that legislation and what it will mean for us?
So, that's an answer really at the federal level, but we have been reassured from the federal government. Their understanding is that this does not involve the mRNA vaccines, the Pfizer or the Moderna vaccines. But that's why we always qualify everything we say about our program is contingent upon getting the supply that is based on the federal contracts.
Following up on the Moderna delay, you've been clear that 2 weeks was everything promised within 2 weeks would be delivered. And if I'm understanding you right, this actually was promised within 2 weeks and now is not showing up. Can you tell us what happened there?
As I said, we were notified very late last night. I think it was something to do within the plant and their quality control is all I'm aware of. It pushes us out that delivery by about a week, is what we've been told. So we can cover that gap with our existing supply, but it's an indication of why we can only plan the clinics with certainty and give people appointments in these 2 weeks blocks, because we don't have assurance of supply. This is very last minute, but we it's something we have to adjust to.
Next question will go to CTV's Natasha Pace.
Thank you. With the outbreak in Edmonton, is there any thought right now, Premier, to reconsidering the Atlantic bubble, or at least the timeline for the Atlantic bubble?
We'll be watching it very closely, and I'll stay in contact with Dr. Strang to make sure that we have our outlook at all our neighboring provinces and beyond. At this time, we're still looking at April 19th, and I'll look forward to future see what developments to see how the outbreak is contained. Hopefully it is contained just to that northern region of New Brunswick. Newfoundland seems to be doing quite well, so we'll monitor that as well.
Go ahead with your follow-up, Natasha.
Thank you. Dr. Strang, how concerning is it to have cases now in 2 schools in the last 2 days?
So we know that the cases are connected, and we know that their likely source for them is. I'm not overly concerned, but I'm never complacent about COVID either. But as I said in my remarks, this is to me of what we expect to happen. We have periodic, sporadic cases. We have a good process where we recognize them early. We move in rapidly with public health follow-up of the contacts, and then we're doing testing in both of the schools, and then we're expanding testing and opportunity, as I said, at the Sackville Legion over the weekend for anybody in that community. It's the way we've been successful so far. We react quickly with kind of wrap our arms around the cases and contacts, and then we do expanded testing in communities to see if there's any sign of any spread far beyond that. And so far, that's worked very well for us, and we've been able to keep our by and large our cases to with limited spread beyond the initial cases and their close contacts.
Next question will go to Alicia Drouse with Global.
Potentially regretted not acting sooner and when cases start to rise. So I'm just wondering why we're monitoring the New Brunswick situation but leaving our border open. Why not, I guess, act preventative and close the border before this gets worse?
Well, everything's always about balance, and everything we do, even reinstituting that border, reinstitutes imposition and a lot of challenges for families in Nova Scotia. Right now, we're at a position where it's confined in northern New Brunswick, and that area is locked down, so and with no travel in and out. We did exactly the same back in November when there was another outbreak in the Edmonton area. We didn't close, put a 14-day quarantine for all New Brunswick. We advised Nova Scotians not to travel to that part of New Brunswick, and we monitored it. So I think we're taking the appropriate approach of finding the right balance, and we're watching it very carefully. As I said in my remarks, if we start to see spread of this variant beyond that Edmonton area into other parts of New Brunswick, then that's an increased risk, and we'll continue to look at that. And then the Premier and I will have conversations about what we need to do in terms of perhaps strengthening our response.
Go ahead with your follow-up, Alicia.
And earlier this week, both WestJet and Air Canada announced more flights coming into the area in June, including routes going in and out of the Atlantic bubble. I'm just wondering, they seem to kind of indicate that there's cautious optimism that we'll see a reopening to the rest of the country by July 1st. So is Nova Scotia expecting to open at any point to the rest of the country this summer?
I don't think we have any plans either way. We have to watch the epidemiology very carefully. When we see substantive increases in Alberta, British Columbia, parts of Ontario, Regina, there's a lot of work, a lot of time, but also a lot of work that needs to happen between now and the summer for us to be in a place where we could say it's safe to open our border and remove the quarantine for outside of the Atlantic bubble.
Next question will go to Keith Doucette with Canadian Press.
Yeah, Dr. Strang, I want to go back to the border or the boundary issue again. You say Edmonton's far enough away that you can safely keep the border open for now. I'm wondering how close it actually has to get. You say spread in New Brunswick. Can you define that a little better so that people have a better idea of what you mean about trying to be reasonably safe?
New Brunswick's divided into 5 health zones, and so what we're seeing is an outbreak in a portion of one of their health zones. So my epidemiologists are talking today with New Brunswick. I talk regularly with Dr. Russell. So what we're watching is spread beyond that. I don't have a defined if it's only in Fredericton or only in St. John, but not Moncton. I think what we're concerned about is actually watching is there spread beyond outside of that very specific place, which is Edmonton and Edmundston and surrounding communities. If we start to see that spread, that's a very concerning sign.
Keith, go ahead with your follow-up.
Yeah, on the vaccine rollout. In terms of resources, is there any thought that if things actually do ramp up as we expect, to expanding the number of people who will be able to administer shots? I'm wondering about if you could just tell us who are eligible now to give the shots, and then are you looking at other people?
We have some folks within public health, within existing folks in the health authority. We're working, 2/3 of our vaccine is going to be delivered through pharmacies and some physicians' offices. And certainly in our community clinics, I think it's over 300 retired nurses and physicians come back. When the people who are in charge of doing the planning were very comfortable that we can, what you saw on the graph in terms of the rapid trajectory in getting to mid-June for all adult Nova Scotians, we can do that within our existing human resource capacity. If we get more vaccine and we can speed things up even more, then we have some options that we could go to if necessary. But we can deliver by mid-June within our existing HHR capacity. And then I always have to remind people that that's the first dose. And then we have to use that same capacity then through the summer and fall, because the same people are all going to need their second dose as well. And there is research going on about kids, so we may be able to add kids into this cohort as well. So we're always looking at our human resource capacity. Right now we feel we have adequate capacity, but there are options that we could look at to bring more if necessary.
Next question will go to Nabal Snan with the Chronicle Herald.
Good afternoon. Dr. Strang, you spoke last week about working on specific solutions for access to vaccines in Northern Cape Breton. I was wondering if you can tell us a little more about what these solutions would look like.
Yeah, we're working actively on a community clinic in Neils Harbor. And I thank the physician community in Neils Harbor. And soon, we're working with them about how we established a clinic. We have pharmacies in the Shetticamp area. So if you look at northern Cape Breton and on either side of the national park and upwards to Meat Cove, we have options on Shetticamp, and we're actively working to develop a community clinic on the other side in Neils Harbor.
Go ahead with your follow-up, Nabal.
Thank you. I realize that the current recommendation is to get the second dose 16 weeks after the first dose. But I was wondering, Dr. Strang, if it's possible for people to book their second dose anytime between 21 days and 16 weeks if they wish? Or is the only option just to get it 16 weeks later?
The recommended interval is that 16 weeks. We're starting at about a little bit before that, 15 to 16 weeks, to give a bit of flexibility. But we need to focus on all the vaccine we have going into as first dose for people. And then we'll start getting, once we've done that, then we'll start getting people with their second dose. But other than in our long-term care facilities and the folks who, as I've said before, who got their first dose of vaccine under the understanding they get their second dose in 3 or 4 weeks, other than those groups, everybody now is getting it and will get it in 15 to 16 weeks, so we can focus all our vaccine in first dose, because that's how we need to build that immunity as high as we can in our communities with people, as many people as possible with first dose. dose before we shift to the second dose. But having said that, I need to remind, the second dose is equally important. It's just we have to phase this in the right way so we build population immunity with the first dose and then sustain it with the second dose.
Next question will go to Victoria Walton with the Coast.
Thanks. Dr. Strang, I'm wondering about close contacts as they've been reported lately in, the press releases. It says 2 of the 3 new cases or whatever are close contacts. But I'm wondering at what point we consider that community spread. Like if it's spreading from one high school to another, is that community spread?
So we is close contacts in different ways, whether it's workplace, household, and other ways, and we're very careful about how we phrase that, so we're not, disclosing personal information. But when it gives us reassurance about when we say person, we have a case, and then we had rapidly around a case, we develop who are the people that have been in close contact with that case. It could be at home, it could be in school, it could be in the workplace. But if those close contacts, who we isolate them and test them, we expect some of them. We're not surprised when some of them come back as positive, because we can explain their transmission. And so when we can't explain cases that are occurring and we don't really know where that's when we can become concerned that there is actually community exposure.
Go ahead with your follow-up, Victoria.
Thanks. And Dr. Strang, I'm just wondering about the AstraZeneca, that initial 13,000 doses. Are there any of those left that aren't appointments booked for?
No, my understanding is that virtually all those 13,000 appointments for each of those doses of vaccine have been filled, and so that's we're immunizing people this week and next week because the vaccine expires April 2nd.
Next question will go to Shayna Luck with CBC.
Good afternoon. Dr. Strang, we're hearing that NACI will review the extended time period for the second dose amid the concerns about the immune response in seniors. I'm wondering what kind of options we're looking at if the guidance from NACI should change again.
So we'll have to see what recommendations NACI brings. I mean, I know it's under active consideration. Dr. Deeks, who's actually the co-chair of NACI, is actually acting as my deputy chief MOH. So I have the privilege of her being next door to me in my office. So we have lots of conversations. So we'll see where NACI lands on this.
Go ahead with your follow-up, Shayna.
Thank you. This question is for both Dr. Strang and the Premier. When your time comes for the vaccine, would you commit to doing that publicly to send a message to anybody who might be hesitant about a vaccine?
Absolutely, I would.
Yeah, I'm happy to get vaccinated when my turn comes, and if people want to have a picture of me getting a needle in my arm with a smile on my face, I'm happy to do that.
We'll go back to the room for one more question to All Nova Scotia's Lindsay Armstrong.
Thank you. Dr. Strang, given what you said today about your concerns around variant cases in New Brunswick, I'm going to ask again about sequence testing capabilities in our local lab here. I'm wondering if you have received any funding from the federal government for this, or if any work has gone on in the lab to do this. And I'm also wondering roughly if you can tell me how much money was requested to make these upgrades.
We have I don't have an exact number. We have a proposal into the federal government. We're hoping to maybe hear next week, possibly, that was testing. One of those components was to build the genetic sequencing capacity here in our lab. And I frankly can't remember out of the full amount how much it was for that. Right now, it's about a week turnaround time to get our variant results back. So it would be very nice to be able to do it here, but it's not hindering our response in any way, because we take action right away on cases, and we'll never, there's always going to be some amount of a time. Like even if we can do it here locally, it's going to be a few days. So it would be very nice to have that, but it's not something that is I would say, hindering our public health response around cases.
Next question will go to CBC, Jean Laroche.
Turns out your staff at Health are very quick to respond. 14,200 is the number of Moderna doses that will not be, or will be delayed. I'm just wondering, explain to me how you could shift 14,000 and not affect it, not have it affect your trajectory at all. Like you said, you talked about adjusting. That seems like a large number to adjust.
So we still have some vaccine that is being held back for this week and next week for the second dose. So what we're doing is shifting some of that for second dose and using it for the first dose piece. But that if we don't get the delivery as we're expecting next week, then we're going to run into some problems around that second dose piece. But we're having to adjust. I'd much rather take the risk of a second dose than not get not allow us to continue to progress with our first dose into people's arms.
Define some trouble. You said some trouble.
Well, it would mean that we would then be in a position where there are people who should be getting their second dose that we don't have the Moderna vaccine for. So we're trusting that the federal government is saying it'll be delayed up to a week. It may be less than a week. So we're making, this is late, this happened late last night. I was calling and texting with our vaccine team with Tracy Barbrick at 11 o'clock last night. You know, so it's not ideal for us by any means, but we don't have control ultimately of our vaccine supply, and we have to adjust as best we can.
Next question will go to Tim Biscay with the Halifax Examiner.
People are understandably anxious about the vaccine rollout, and they want it quickly. In the past, I don't think I didn't hear any objections to the vaccine being diverted to the Northern Territories. But as the situation deteriorates, I guess, in Ontario, has there been any talk of diverting vaccine from Nova Scotia to other provinces? And is the federal government keeping to its per capita allocation?
And so far, there's been no talk about diverting, and we continue to take the position, along with other provinces, that we expect that we're going to get our per capita allotment.
We'll go back to the phones for one more question. We'll go to CTV's Natasha Pace.
Thank you. I'm wondering what message you have, Dr. Strang, for people who are hesitant about getting the vaccine. I know earlier this week you talked about a campaign that we'll be launching to help reassure Nova Scotians. What's your message to them today?
So I think the message is that all of the vaccines we have, the ones that are licensed, have gone through the same regulatory process that any other vaccine products that we use. We know that our products are effective. We know that they're safe. We know that, especially with the variant threat around us, that we need as many people as possible to get vaccinated. So it's not just for yourself that you get vaccinated, it's for others around you, like we've been doing for the past year. And there are people in our communities who, for a small number, who may not be able to get any of the COVID vaccines. There are others who may not be, like with flu vaccine, because of underlying health conditions or age, they may not get as good of an immune response as others. And they're relying on us, the rest of us, to get vaccinated to protect them as well. So again, the message that we've been pushing, and Nova Scotians have responded throughout the pandemic, is taking the necessary steps to keep each other and our community safe. Vaccine is now is the next thing we're asking people to do. Think not just about yourself, but think about your community as you make your decision around getting vaccinated.
Next question will go to Alicia Draus with Global.
Dr. Strang, can you give an update on the status of the vaccination rollout within the African Nova Scotian communities?
We're expected that we're working with those communities. Those communities, rightly so, said they want to be in charge of communicating to their communities, be the first ones. So we know that you'll be hearing things from those communities in the coming days.
Okay, moving on to the Canadian Press's Keith Doucette. Moving on to Nabal Snam with the Herald.
Dr. Strang, I wanted to ask you again about the recommendation for the timing between doses. So do you see a time in the future, perhaps in the summer when we have more people vaccinated across the country and more vaccine supply, when the recommendation could change?
So I don't see that supply has got anything to do with the scientific recommendation on the interval between doses. We'll continue to follow the NACI recommendations around what is the appropriate and safe, and as well as or the interval that is driven by both safety and what's the appropriate interval to have maximum effectiveness as well.
Next question will go to Victoria Walton with the Coast.
Thanks. Just a few minutes ago, the Premier kind of wrapped up with some heartwarming stories, and one of those was about a person giving their vaccine appointment to someone else. Dr. Strang, I'm wondering if that's something that happens a lot. Is that recommended? Is that kind of just a one-off thing? And yeah.
So I think I thank that person for taking that step, and that's a very grassroots thing. It would have happened at the clinic, and I'm sure she got support to rebook her appointment. So I don't know if there's other examples like that, but it's I'm glad people respond that way with kindness to each other.
Next question will go to Shayna Luck with CBC.
Air Canada said it will restore some service to sun destinations in early May. Wondering what you would say to people who might look at our vaccination schedule and think our plan is to have everyone vaccinated by June, so I can start looking at recreational travel again.
So the federal government is not they're still advising Canadians that international travel should not happen unless it's absolutely necessary. We're still in the middle of a pandemic. The vaccine doesn't just instantly make everything better. We're going to have to come out of this very slowly and carefully. So I think people who are thinking about travel should be thinking longer term about their travel plans and not what they may be doing just because they may have had a dose of vaccine sometime in the next few months.
And that's all the time we have for questions today. Go ahead, Premier.
Thank you again to Nova Scotians who, through their efforts, through your commitment to health of your communities and loved ones, are helping keep our province safe. Your government is doing the work to see that Nova Scotians receive their vaccinations, to see that Nova Scotians are protected from COVID-19. Be sure to make an appointment to receive your dose of vaccine when it's your turn. In this way, we will reach the population immunity that we need. Until then, keep following public health protocols, practice good hand washing, keep your distance, and keep wearing your mask. And we'll get through this pandemic towards a brighter future together. Thank you. Have a good weekend.